Hi, my name is Amy. I'm going to be your nurse today. Do you have any questions before we get started?
Nope.
I'll be doing a full physical assessment on you, and it'll take about 20 minutes. I've washed my hands prior to the exam. This is Haley. She's a 12-year-old, well-developed, well-nourished female. Throughout our assessment, I will be monitoring her behavioral and emotional status. Haley's vital signs are normal with a heart rate of 60, blood pressure 104/62, respiratory rate of 20. She's 100% on room air, and afebrile 36.5. I'm going to go ahead and assess her head, first palpating for any lumps or bumps or tenderness. And then I'll just be looking at her scalp for any lesions and infestation. Haley's head is normal cephalic. Assessing cranial nerve number 7. Haley, I'm going to have you raise your eyebrows, puff out your cheeks, and smile. Cranial nerve number 7 is intact. Now checking sensory portion of cranial nerve number 5. Haley, I'm going to have you close your eyes and then tell me when you feel me touching. Okay, cranial nerve number 5 is intact. Now I'll just be palpating the paraspinous muscles, and they are symmetrical, and the trapezius muscles, which are also symmetrical, and her sternocleidomastoid muscles, which are symmetrical. Haley's trachea is midline, palpating her carotid arteries. Both are 2+. Assessing her occipital lymph nodes, her posterior auricular lymph nodes, pre-auricular lymph nodes and post-auricular lymph nodes, submandibular lymph nodes, submental lymph nodes, anterior cervical lymph nodes, posterior cervical lymph nodes, supraclavicular lymph nodes, and infraclavicular lymph nodes. Now assessing cranial nerve number 11. Haley, I'm going to have you turn your head to the side against my hand, and turn your head to the other side against my hand, and lift your shoulders up against my hands. Okay, cranial nerve is intact. Now assessing her TMJ. Haley, go ahead and open your mouth and close your mouth. No crepitation noted. Move your jaw from side to side. And the motor portion of cranial nerve number 5 is intact. And now I'm going to have you move your tongue from side to side and say la la la.
La 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 la.
Okay, and cranial nerve number 12 is intact. Now moving up to Haley's eyes, assessing that they are both symmetrical. Her eyebrows are nice and full. Her lashes look healthy. Pulling down on the lower lid. Her conjunctiva is nice and pink. Her sclera is white, and her iris is blue. Haley, I'm going to go ahead and assess your extraocular muscles, assessing cranial nerves number 3, 4, and 6. So I'll have you watch my finger. And those cranial nerves are intact. And now I'm also going to check for accommodation. So Haley, I'm just going to have you watch my finger. And as my finger comes in, her pupils constrict, and when my finger comes out, her pupils dilate, which would be normal accommodation. Now assessing Haley's visual pupillary response to light, and that would be cranial nerve number 2. And that is normal. Next I'm going to be checking Haley's corneal light reflex. I'm just going to have Haley look right at my nose. Okay, and the reflection of the light is symmetrical on both eyes, which would be a normal finding for the corneal light reflex. Next I will be doing the cover test with Haley, which, there you go. I'm going to have you cover your left eye and look at my nose, and then remove the paper. Okay, and neither eye moved, and now cover your right eye and remove it, and neither eye moved, and that it would be a normal finding. Now I'll be assessing Haley's visual acuity. I don't have a Snellen chart, but if I did, I would have Haley hold it about 14 inches away from her body, covering one eye, and then reading from the 20/20 line, and then covering the other eye and reading from the 20/20 line. If she could do that, her visual acuity would be intact, and she would be 20/20. Next, moving to assessing Haley's ears. We'll move from the lateral canthus of the eye and kind of draw a line up to the top of her ear on both sides, and just noting that they're both symmetrical. Her ears are up and down, palpating Haley's auricle here. Does that hurt at all? The pinna and the tragus. And inspecting for any lesions on Haley's ears or any fissures. And there are none. Haley's ears are normal. And now I'm going to inspect Haley's nose. I'm going to go ahead and check cranial nerve number 8 with the whisper test. So Haley, I'm going to have you plug your right ear. And I'm going to whisper 3 words, and I want you to repeat them to me.
Black, pink, purple. Black, pink, purple.
Okay, now cover your other ear.
Purple, orange, green.
Okay, and that is cranial nerve number 8, and it is intact. Now moving on and assessing Haley's nose. I'm just assessing that the skin looks good. There's no rashes or lesions there. Checking the patency of Haley's nose. I'm just going to have you breathe in and breathe in. Bilateral nares are patent, and she has no congestion or edema there. If I was going to check cranial nerve number 1, which would be for smell, I would just have her smell something and then tell me what it is that she is smelling. Now I'm going to assess Haley's mouth, and I'll start with her lips, which are nice and pink and symmetrical. I don't see any lesions on her lips. And then Haley, I'm going to have you open your mouth for me. And looking at her teeth, her dentation is good. Her teeth are nice and straight. The gums color the teeth well. Her buccal mucosa is nice, pink, and moist. Haley, go ahead and lift up your tongue there. No lesions on her tongue. Move your tongue from side to side. And there are no lesions on the lateral portions of her tongue or the top. Stick your tongue out and say ah. The uvula rises and is midline. That is cranial nerve number 9, and that's intact. Her tonsils are about 2+, and the pharynx is nice, pink, and moist. Now moving on, I'm going to assess Haley's posterior thorax. And I will just be looking at her back. I'm going to have you take your sweater off, Haley. And normally I would be doing this without any clothing on, assessing her skin for any lesions. I'm going to have you turn to the side, to this side here. And then I'm going to palpate all the way down to the lumbar spine for any bumps or tenderness. Does that hurt at all? Okay, and then I'll check CVA tenderness. Does that feel? And that's negative, which would be a normal finding. Her AP ratio is 1 to 2, which is normal. And then I'm going to check her inspiratory and expiratory symmetry with her thorax. Go ahead and take a deep breath in and breathe out. And my thumbs move away and come together symmetrically, which is a normal finding. And now I'm going to auscultate Haley's lungs from the apex down to the base using the diaphragm of my stethoscope. And take a deep breath in. 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 Now assessing her lateral lung fields. Deep breath in. And deep breath in. Deep breath in. Deep breath in. Okay, and moving to the anterior thorax, I'll be assessing her lungs, apex to the base with the diaphragm of my stethoscope. Take a deep breath in. 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 and deep breath in. Okay. Haley's lung sounds are clear throughout. There's no crackles, wheezes, or bronchi heard at all. Haley does not appear to be in any respiratory distress at all. Haley, I'm going to have you lay on your back for me. And I am going to palpate Haley's chest for any thrills, starting with the aorta here, and moving over to the pulmonic, Erb's point, tricuspid, mitral valve, and then at this point I'll also be assessing Haley's PMI, which would be the fifth intercostal space, midclavicular line, and I can palpate her PMI there. Now I'm going to auscultate Haley's lungs, first listening with the diaphragm of my stethoscope. I will listen over the aorta, which is second intercostal space, right sternal border. Pulmonic would be second intercostal space, left sternal border. Erb's point, where S1 and S2 are heard evenly, would be third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. Mitral valve, fifth intercostal space, midclavicular line. Okay, and now I will do that again, listening to the same points, but this time with the bell of my stethoscope for lower tones. And again, mitral valve, tricuspid valve, Erb's point, pulmonic valve, and aortic valve. And now I'm going to listen over Haley's carotid arteries for any bruits. And now I'll listen on this side. Again, that's with the bell of my stethoscope. And I don't hear any bruits. And